That would be me again. Okay, so we're here this morning with an agreement with the California Department of Public Health to address possible reemergence of Ebola here in the United States. So following the recent outbreak that everyone's heard about, CDC awarded states funds to, one, identify and prepare dedicated Ebola care hospitals. There's a lot of security and negative air pressure things that need to go along with that, and to ensure they're properly equipped and staffed, and the staff are appropriately trained. And then two, to expand local public health jurisdiction responsibilities to include Ebola-specific emergency preparedness. So, preparing for possible Ebola outbreaks means a lot of training and drilling for public health staff, medical providers, and first responders in investigation, identification, and surveillance of Ebola. It also means working closely not only with our local emergency preparedness partners, but with state and federal health officials. Presently, travelers coming into the United States from Sierra Leone, Guinea, and Liberia are routed through dedicated airports and screened for potential Ebola. Where specifically, they're being asked where specifically they've been, their contact with Ebola patients, etc. Before they can travel on to their final destinations, local health departments are notified and provided with instructions for monitoring them. So if, I'm just making this up off the top of my head, if someone from here had been to Sierra Leone and maybe they had been in a region where there was Ebola, we would be notified by CDC that someone was on their way to us, and we would get instructions for monitoring, which might be such a thing as calling them up and asking them to tell us their temperature every day for a period of time so that we can monitor that, see if there's any change there. It could be more specific. It could even be isolation or quarantine, depending on what their risk was. Monitoring can be as non-invasive as having them phone in their temperatures, that's what I just talked about. The staff will also be working with other regional partners to ensure that we have some way to safely transport Ebola patients, because you can't just put them in any old ambulance and haul them somewhere and then reuse the ambulance after that. There's a lot to it that I don't know all the deals, but apparently there's some kind of a insert that goes into the ambulance box that you take out and destroy afterwards. So these are the things that we are going to be prepared for. Do we think it's likely we'll see an outbreak here? No. However, preparing for Ebola ensures that we're prepared to meet other emergent disease outbreaks, and that's the approach our public health staff plans to take. We're going to be preparing for Ebola and every other possibility. So, for instance, Nancy and I were just talking about, we had the measles outbreak this year. At the same time, we also had a lot of people who had all the measles symptoms, but they didn't have measles. So there was some kind of new virus on the scene that also mimicked measles. So those kinds of things can happen. They can come out of the blue, and we want to be prepared to respond to those. And this will help us prepare, will help us be help our hospital and our ambulances be prepared for the response too. Every policy, piece of equipment, training, and drill will be designed to prepare us to respond to Ebola and any other potential outbreak of serious disease. Today we're asking you to approve the agreement with the Department of Public Health and authorize the CAO to sign it so staff can immediately begin preparing for these plans. Any questions?
If you had to quarantine somebody, would that be at the hospital?
No, you can quarantine them in their home. I mean, if you have a quarantine facility, you might transport them there. It could be the hospital. It might be the fairgrounds. It will depend on the disease. It will depend on the number, and it will depend on a whole lot of other factors. But typically, quarantine happens in their home.
I think it's important to note that in the news here recently, it was announced that Liberia, one of the countries most affected by the recent Ebola crisis, was deemed Ebola-free. So they were able to track down all the cases and contain it, and eventually either treat them successfully or the people died, but at least they kept it from spreading beyond what it had already. And it was a major task. And
it's a worldwide public health effort.
Yeah. It takes a lot of.
And here in Lassen County, it's not going to affect us. Well, God willing, it won't. But let's hope we don't get stuck with something else instead. But better to be prepared than not.
More questions? Anyone got a motion to approve this? Could I ask her a question, please? Iona McCain. Does this involve that tick Lyme's disease? Is this northeastern California? I heard this on the international news that this has got to be an area where that kind of a disease is very prevalent.
Lyme disease is fairly prevalent here. This doesn't really have anything to do with it, but that is, it's one of the public health surveillance activities that they participate in.
Thank you.
Any more questions?
One question on the term of this contract. I was looking at the budget. It's actually a 15-month time period. Because the federal fiscal year is October 1 to September 30. This shows going from September 1 to 9/30/2016. That doesn't.
No, it doesn't. Something firing up.
Yeah.
No, we just fired the furnace up.
A good thing we have facilities. Facilities guy here. Before the stampede begins.
And contracts where you have, in public health, where you have projects that are spread out over different time periods.
Yeah. I could see them putting it in that framework because of the federal funds.
Okay, any more questions?
I had one more.
Aaron?
In the back, this is the first time I've seen this, a certification regarding lobbying. I mean, is this a new thing coming around, or what's?
Well, that's another one of those ethical requirements. We have to certify that we're not going to be lobbying regard to this, and we don't lobby. But, large counties pay lobbyists to go to Sacramento and lobby for certain legislation that they would like to have, and this is why they put that in there.
So you can't talk to Tim Holabird about this grant?
It is a federal limitation, not a state limitation.
Right.
Yeah.
Yes.
I was going to say, because it talks here, it says influence an officer or employee of any agency, a member of Congress, an officer or employee of Congress, or an employee of a member of Congress in connection with the covered action. So that actually is a prohibition. So you couldn't talk to somebody like Mr. Holabird.
Well, I could talk to him and answer questions. We could have a conversation about it, but I couldn't say, what we really need is a law that does this, or, geez, this is a stupid law, they need to do that.
Or get us more money for this.
Yeah, no, it would just be a conversation in regard to Ebola.
That's good to
this
know,
particular
because
project.
you might want to put out a memo to everybody that be on the lookout not to discuss it with Mr. Holbert, because they could find themselves in trouble, kind of like how they've been talking for Mr. Henry.
Okay, any more questions? Okay, would entertain a motion.
Well, I would move approval of agreement number 18-10362 with the California Department of Health, allocating the $65,683 supplemental funding for Ebola preparedness and response.
Do you have a second?
One second.
Motion is second. Any more discussion? All in favor, say aye.
Aye.
Opposed, say no. The ayes have it. Negotiation order. Big word. Peter, is that you?
Joel.
No, that's all right. Okay.
Joel Ratchey, Lassen County Public Works. Here to seek confirmation of 2015 grazing bid. 5 Ranch was the only bid this year. It's about $1 more per AUM than last year. So we feel good about that. I've been working with 5 over the years since I took the position in 2006, and have a great working relationship with Gabe Williams, the head cowboy for 5 We have lessened the potential AUMs required the last couple of years due to the drought. We're trying to be a little bit light on the land, a little light on the meadows. It seems to be very successful. And today you have the option to approve it or not, as required by state code.
Good. What change?
How many AUM?
Right here. We have 75 cows. Okay, the bid is $17.65 per AUM. Last year it was $16.51.
Well, how many guys do you have out there?
75.
75.
And they're not gonna be there for the full month, are they?
Actually, we lessened it, so we went to an estimated 60 AUM of forage to address your question appropriately.
Okay. Your motion.
I would move, Mr. Chairman, that we approve the grazing lease with the best bidder, I guess.
Second.
Second.
Motion is second, any discussion? Seeing none, all in favor say aye.
Aye.
Opposed, no. Ayes have it. Thank you, sir. Go to H5.
Mr. Chairman, I put this item on the agenda more to highlight the issue with the Fort Sage Unified School District, but also to seek some direction regarding the theater the county owns in Hurlock. As the board will recall, the Fort Sage School District and the county reached an agreement in substance some time ago to transfer the property to the school district as they wanted to use it for graduation. They have subsequently rescinded that agreement and now told us they don't want the building because they don't want the expense of owning the building. They only use it one time a year, reportedly, according to the superintendent there. However, they would like to continue to use it and continue to have the county insure it and so on for their benefit. And that's what the request is, that they be able to use the building for their graduation. So that's what I'm presenting there. Don't see any significant issues with them using the building for the graduation this year, but it does highlight the situation of us maintaining that building, and we don't, for one time a year, and we'd like to get some feedback from the board on how to deal with that in the future, and if we want to continue to do that.
Questions for Richard? Everybody happy?
Who does, we supply the insurance on that deal?
We insure it.
What is the real cost of insurance?
It's really hard to parse out the cost of insurance for that particular building. It's because of the way our policy is. In the scheme of things, it's insignificant in terms of the actual cost of insuring that additional building on our policy.
About me.
Perhaps Pete could speak to that. We did put a new roof on it 2 or 3 years ago, and there's some water usage. I'm not sure what the electrical costs are, but
it's basically vacant, so the utility cost is minor this time, but it's a different matter if you put people in there and start using it on a regular, more frequent basis than once a year. So,
Ask the question. Seeing no more questions, we have a motion to approve this. Motion to provide direction to the county administrator.
we have a request from Mr. Young, who, I guess actually the request, if you look at the letter in your box, it's on behalf of the students of Hurlong High School have asked me to request the use of the theater for their graduation. I kind of see this as an attempt to put the students in front of the administration of the district to make the request. Kind of a shameless act.
Okay, so we need a motion to give Mr. Egan the...
Mr. Chairman, I would move that we grant the students of Hurlong High School permission to use the facility for the graduation exercise on June 12th as a one-time event, and we'll determine in the future what would be the future use of the building.
can I,
We got to need a second for the motion.
I'll second that.
We got a second, Peter?
Mr. Chair.
I'd like to recuse myself from that.
Okay. Mr. Hammond leaving, back to Peter.
we can do it, I don't know necessarily get a motion, but we ask them to insure us, the school district insure us as an additional insured on the use of it. So typically, I think we've done it in the past, but just wanted to bring that to light.
Can we include that in the motion?
Okay, that will be included in the motion.
Is there a second?
Yeah, I agree with that second.
Okay, motion is second. Any more discussion? Seeing none, all in favor?
Why do we still own that? That's just my question.
Why do we still own that?
Yeah, why wasn't that?
It's been discussed numerous times, but I think the action before us is, even with this request, I think we need to resolve that issue.
I think we need to bring that up in the future, dispose that property.
Or,
We thought the answer is we thought we had it disposed of with the school district, and then
they backed out.
they backed out.
But that's, but the other option is maybe it would be more cost effective to renovate it, get to do some stuff with the floors and stuff, and move the resource center there, and maybe be more cost effective to do that than maybe try to fix up the resource center building. I mean, so there's been a lot of discussion and options there, so I think we need to bring that to a conclusion.
Future agenda item.
Maybe future agenda item, please.
Okay?
But in the meantime, let the kids use it for their graduation.
Okay, all in favor, say aye. Opposed, say no. Ayes have it. 6, information to the Board of Supervisors and Mr. Reedy.
Mr. Chairman, just a couple of quick things. I'll be attending the Trindle board meeting later this week in Trinity County. That'll be at our Trindle's new facility that they built this year, which would be kind of interesting. Also, I wanted to mention to the board, I attempted to call Miss Brawley last Friday. She was out of the office. Her staff told me that she was attending her graduation. And so I wanted to point out to the board that Ms. Brawley's been working on her master's degree, and it's now
It's through that.
completed it. And
It's
so,
through that program that CSAC's going
all of you know what a demanding position Ms. Brawley has, and so in addition to that, over the last couple of years, she's been working on furthering her education. I just wanted to recognize
Now she's more qualified for your job
Right.
than you are.
I'm really smart enough to know I don't want to get started.
Is that what education taught you?
Retire as soon as possible.
That's all I have.
Congratulations.
Well, actually, I graduated, but I won't finish school until I take my comprehensive on August 15th, and then if I pass, I'll be done.
Okay, we will recess to 11 o'clock for our proclamation for Mr. and Mrs. Denver.
Yes.
Okay, short recess to 11 o'clock.
Sorry? Mark, have you got a moment?
Is something, isn't